Hi everyone and welcome back to the series 5 in 5. It has been a little while since I've been able to do a 5 in 5 video because life has just been quite hectic. If you don't know the update to my career, I'll link to the video for you to check that video out. If you're new, then a massive welcome to you. My name is Dr. Baptiste and I work as a portfolio GP. And if you haven't subscribed, then why not hit that subscribe button? And as always, if you found value in this video, then be sure to give it a thumbs up. Today's video, I'll be talking through what do you do at the end of an examination or after you complete the examination. I have two 5 in 5 videos that talk about what you do at the start and during an examination. So you may want to check those videos out before you watch this video. Okay, so let's start. So you've completed your examination and what do you do next? So number one, think about if you need to examine another system in more depth. An example here would be musculoskeletal. So if you've examined the patient's knee, do you need to examine the joint above and below? Do you need to examine their hip or their ankle or both? Are they getting pain in the other joints? Do you need to examine the other joints in a patient suffering from rheumatoid arthritis and comes to you complaining of pain in the small joints of their hand? Number two, consider if you need to re-examine anything that you're unsure about. And of course, explain to the patient why. Number three, let the patient know that you've completed the examination. Don't have them sitting on the couch or lying on the couch and they don't know what to do next. Explain to them you've completed the examination and that they can go ahead and get dressed. Of course, you can thank them and ask them if they need any help getting dressed. Number four, explain to the patient what you found, if anything. Explain your examination findings to them. Tell them what do you think is going on, what is the cause for their pain, for example. Give them a few differential diagnoses or tell them what your main diagnosis could be. Explain the management. How are you going to confirm or refute what you think it could be, your differential diagnosis? And make sure in the management plan that you involve them in any decision making. So you create a joint management plan with the patient. Of course, you can ask them if they have any questions about anything, any questions about the examination, any questions about what you said going forward, and you can book a follow-up with yourself or with a colleague. Number five, very important, make sure you wash your hands and you remove your PPE. Of course, disinfect your equipment and the clinical area. Number six is documentation. Ensure you document everything that has occurred in the consultation. Of course, your examination findings, positive and negative findings. If the patient declined a chaperone, then of course write patient declined chaperone. Make sure you document this clearly. If the patient accepted a chaperone, then make sure you write down the full name and role of the person. Now, of course, you can include your impression, what do you think is going on, and your management plan. And of course, you can go ahead and then book things like bloods or imaging to help you in managing this patient. So that's a quick overview, a very quick overview. I hope you found it useful. If you did, then make sure you give it a thumbs up. Subscribe if you haven't already. I will see you in the next video.